Hi, I'm Graham Parker. I hail from the Midwest. I grew up in Missouri, or as we would say, Missouri. I went to public school there. I went to University of Missouri for undergrad and medical school. When I finished medical school, I went out to Colorado, and I was at the University of Colorado for internal medicine training. And when I finished that, I went to the University of Pennsylvania in Philadelphia for cardiology training, and I did a 3-year fellowship there. I was actually in practice for 2 years in Philadelphia before I moved to join Ed Lominac many moons ago, specifically July of 1989. I was the second person to join Ed, and in the ensuing years, as you can see, we've grown dramatically. I've actually known I wanted to be a physician for years. My father was a general surgeon, and I used to accompany him to hospitals and to his clinic for his rounds, and then I would just kind of spook around the clinic when I was a boy, and I always had the ability to watch him interact with patients and see the kind of work he did. So even from a childhood, I knew I wanted to be a physician. During medical school, I had a big ongoing debate with myself if I wanted to be more cerebral and introspective and go along the internal medicine aspect of things, or whether I wanted to be a man of action and be a surgeon. And once I realized that cardiology was the best of both worlds in my mind, there was a very thoughtful aspect of the profession, and yet it also offered the ability to go in there and actually help people in a very dramatic and finite way. So I'd say it was actually specifically my junior year in medical school, I realized that cardiology I thought would be a perfect match for me. Well, my practice has evolved over the years. When I first joined Ed many years ago, we had to do a lot of things. But as the group has progressed, we've been able to actually subspecialize within cardiology, and that's allowed me to really do what my heart's work is, and that's interventional cardiology. So although I see patients in the office and do some of the routine cardiac procedures and care, mainly I do diagnostic heart catheterization and then interventional cardiology, which is a percutaneous solution to obstructive coronary artery disease. When I'm not in the hospital, I enjoy family life very much. I have been fortunate enough to have a place on the lake, and so I enjoy a lot of water sports. I enjoy snow skiing. I also have been an advocate for the symphony orchestra and the museum in town. We're very fortunate to have a first-class museum and a first-class symphony orchestra, so I enjoy the arts as well as the active lifestyle.